Um, some of us don't even understand, what this hypertension can cause. It's not just, hypertension, your blood pressure is high and that's just it. No. The problem with hypertension are the effects, the complications that come as a result of your blood pressure being high. So what happens in hypertension? I've already told us that the heart is pumping against very high pressure to release blood into your blood vessels. And what that means is the heart is pumping very little blood to your blood vessels. So what happens? That means the blood getting to your organs, to every organ in your body, is reduced. And our organs need blood to function because the blood is carrying oxygen. The oxygen we breathe in is the blood that carries it to your organs. So the organs need oxygen. Every part of your body needs oxygen. Your brain, your kidneys, your liver, they need oxygen to survive. And what happens if the blood that is supposed to carry this oxygen is not, enough? It's not carrying, the blood vessels are not carrying enough blood to the organs. That is what leads to these complications. Now, what happens when your kidneys are not getting blood? That's when we have kidney problems, kidney failures. So, as much as kidney problems can cause hypertension, that is a different pathway altogether. But hypertension can cause kidney issues too because your kidneys are not getting enough blood. So we have hypertensive nephropathy. So that means a disease of your kidneys. What else? Eye issues. We call it hypertensive retinopathy. That means the blood supply to the eyes are not they are not adequate. So most times we see people blood vision. Sometimes when you go to the eye doctor, they ask you whether you have hypertension or diabetes because these things affect the eyes, right? If there is no blood flow to your eyes, you're not going to see properly. So the first thing you have to rule out if you're having eye issues is hypertension, whether your blood pressure is high, because it affects. Then another thing is stroke. Now, there are two types of stroke. First is the one that is hemorrhagic. That means blood is flowing into your brain. The second is ischemic. That means blood is not getting to your brain. Now, hypertension can actually cause both. That means the pressure for hemorrhagic, the pressure of the blood vessels in the brain is too high. So what happens when you have you know, a small pipe and there is so much water flowing through it? If it's doctors will know because if you use, a yellow cannula and, you're using a 10 mil or 20 mil syringe, what happens? It blocks, you know, it blocks, it spoils. So sometimes also, let's just use a pipe. You're pumping so much fluid into a tiny pipe. At a point, it could burst. That's what happens in the brain. The pressure in the blood vessels, they are so high. The pressure is really high that those blood vessels burst. That's what leads to hemorrhagic stroke. You go to the hospital, they do a CT and they tell you, this person is bleeding into their brain. That's what it is. Then sometimes it's not bleeding into the brain. The blood is not even getting to the brain at all. So what happens when you have something living and it's not getting blood? It starts to die, right? So when blood is not getting into your brain at all because of that high blood pressure, what happens? That means your brain is not getting blood. And if your brain is not getting blood, your brain that controls every other part of your body, what do you think will happen? You start having different things. That's why people have stroke. When someone has stroke, they cannot walk. The part of the brain that is affecting the limbs is affected. The part of the brain that is controlling your speech is affected. So those are the things. Then we have neuropathy. That means the blood is not being supplied to your nerves. Every part, as I said before, every part of our body needs blood, even your nerves, the nerves that help you feel, you know, that, a pin is touching you, you're feeling it, is your nerves. You understand? That someone touches you and you feel it, it's your nerves. So what happens when the blood supply to these nerves are not there? That means you're not going to feel anything you touch, you don't feel. If you hit your leg, you don't feel it, right? And when you don't feel, what happens? That means you're likely to get injured and you don't feel it. Your wounds are likely to get infected and you will not feel it. Sometimes people come down with ulcers that cannot heal because they cannot feel anything. By the time someone sees it, that means that leg is gone. It's almost gone because you cannot feel it, you cannot feel pain, you cannot do anything. Then, if blood supply is not getting to our legs, our hands, we call them, the blood supplies there are called like end arteries or end blood vessels. That means as the blood vessels are getting to that side, they're getting smaller. So if blood is not getting to those small parts of your digits, that means they start dying. When blood is not getting to something that is supposed to work with blood, what happens? It starts dying. It's like, oh, plants are not getting oxygen or getting water. What do? They die. Same thing with our organs. Once our limbs, our hands, our legs, we're not getting blood, you see them dying. So please, hypertension is not something to play about because it affects every part of your body. Any part that is not getting blood starts to malfunction, starts to misbehave. So we have to tackle it. We have to take care of ourselves. We have to prevent hypertension by all means.